Hello. You're already looking. I'm a minute early. I've just invited. Vicky, how are you? I went on a minute early because I wasn't sure if I really knew how to invite somebody live, and I wanted to make sure. You're all very welcome. Delighted to have you on board. And this is, of course, tonight our live. We're going to talk about periods with Dr. Vicky O'Dwyer, who is a consultant obstetrician and the director of gynecology at the Rotunda. And this is for Science Week. In association with the RCSI and the Rotunda and Science Federation of Ireland. And let's kick off. I think let's people are listening. So if we can, I'm going to just ask you some really or obvious questions. Vicky, will you explain to people why we have periods or what a period actually is? Because I think unless people understand that, it's very hard to know normal from abnormal.
Yeah. So I guess each month people get a period. So what happens on the first day of your cycle is that your hormones are changing. Estrogen is causing the lining to grow throughout the first half of the cycle, so that when you ovulate and then possibly get pregnant, the lining is thickened up. The progesterone keeps it nice and thick, so that if there's an embryo there, that it has something to implant into. But then if you don't get pregnant, your progesterone level drops and you have a period, and it's that lining that's being shed each month. So basically, if you're not pregnant, you'll get a period.
Okay. And so the first half of the time after your period is when you're building up to ovulation. And then the second half is you're kind of laying the groundwork for implantation. And then it goes again if the egg isn't fertilized and doesn't implant. So is that it in kind of a nutshell?
That's pretty much it. Yeah.
Okay.
Yeah.
So then explain to people about how long a period should last and about how long their cycle should be, because that gives them a sense of the monthly normal bit.
Yeah. So I guess a normal period is kind of anything from 3 to up to 7 days, with the average being about 5 days, I think, for most women. And then we talk about what is a normal amount. And books will tell you 80 mils, but I think maybe women who use a menstrual cup will know mils. But I guess lots of them will come and see me because they have heavy periods. So the way that I would ask, to find out, are they heavy? Do they soak through pads? Do they have to wear double protection, so tampons and pads, to prevent them leaking through? Or do they pass clots? And they're all signs that the bleeding is heavier than it should be. Then if you talk about cycle length, so anything from 21 to 35 days is a normal cycle length. So day 1, start the cycle, until the very end, when you get a period. And when we talk about the period, and anytime someone comes to see me and any gynecologist, the first thing people get asked is, what was the date of your last period? And we mean the first day, that day it started. And no one ever knows this, so they always take out the phone and have a look. But most people now will know their cycle length, and particularly women who are trying to conceive, they're really in tune with where their cycle is at. So, young girls kind of in their teens, they'll often have a slightly longer cycle, and they have slightly heavier periods. As women get into their 40s, actually, we see that because of hormone change, again, their periods can get a little bit heavier, their cycle length can change, and that can be normal or it can be a sign of a problem. And then as women get towards menopause, the periods space out. And you might find someone will have just a couple of periods a year, a couple of periods a year, spacing out to then maybe 2 a year, and then stopping altogether.
Okay. And menopause, for people, we're not going to spend too much time. I know we're doing other things on menopause, but that's just when you stop, that your last period is the menopause. And I think it's the perimenopause women often talk about all the symptoms of. So the cycle, you were saying it can vary in length. And what I used to say to patients was, when they would come in about periods, if I used to say, look, they're a bit haywire sometimes in your teens and early 20s, and then maybe in your 40s towards the end, they seem to run pretty smoothly in the middle. And that's kind of reflective of people's reproductive life, isn't it? The way I'm using gestures and everything here that no one can see.
Yeah, and often the teenagers, it's that those cycles are what we call anovulatory cycles, where they're not ovulating. You're not expecting them to get pregnant, but it does make the period the cycle slightly longer, and sometimes the period slightly heavier. And actually, for anyone who has teenagers, there's a really good Instagram page called My Girls Gynae, which is run by an adolescent gynecologist, Geraldine Conley, who has worked here in Rotunda for many years. It's a brilliant page, so that's worth checking out.
Okay, good. So that's why we get them. Your cycle can last between 3.5 weeks and 6 weeks or whatever and probably still be normal. It usually lasts between 2 and 7 days or whatever. So these people will recognize some of these things.
Yeah.
One of the things that I think women struggle with is knowing what's abnormal, because people don't talk frankly about periods. They could be heavy and you don't ask them to have mills, because I've had periods for nearly 40 years and I wouldn't have a clue how many mills. People do know about the pads and the tampons and those types of things. But what should people be looking for by way of being normal or abnormal? Is it just the heaviness of the flow? Is it pain? Is it mood? What are the abnormal things that maybe people are living with, Vicky, and thinking they're normal because they've never known anything else?
Yeah, like I often see that people will come to you and say, oh, well, I thought it was normal. And then when they have the treatment, they're like, why didn't I do this 2 years ago, 5 years ago? I guess the big red flag is if it stops you doing things that you want to do, things you normally do. So for the young girls, if they're not going to school because the pain is too bad, because the bleeding's too heavy, if you're missing work, if you can't go to the gym, if you can't do things you want to do, if you want to murder your husband because you've got bad PMS, like there is a variation.
I want to murder him that are nothing to do with that, but we won't get into tonight or anything like that. So that's a really good description. If it's interfering with your life as you want to live it, that's kind of unacceptable.
Yeah, absolutely. And then I guess pain there's a lot more airtime given to endometriosis, painful periods, than there used to be, which is great because it affects 1 in 10 women. But there are lots of things that cause pain. So what is normal, like if you have cramps day 1, day 2, hot water bottle, bit of paracetamol, and you're grand. But if you're getting severe pain before the period, it's lasting the whole way through, you can't do anything, it's excruciating. Like that's not normal. And always the first protocol is the GP or a women's health clinic, like the Irish Family Planning Association, the well-known clinics, they're all brilliant. And that should be your first protocol. And then there's a small percentage of women that get referred to a gynecologist.
Yeah. So if someone is listening there now and watching us talking about it, they're going to go, actually, I use shed loads of tampons and pads. I have terrible pain. I have flooding and clots and I'm as moody as hell and I do want to kill everybody, not just and I've all of these symptoms. What can be done? Because people need to know that doctors like yourself or GPs as well have the to intervene with these symptoms. It isn't just put up and shut up.
Yeah. So I guess for heavy periods, the best treatment is the Marina coil. And sometimes I feel like I work for the Marina coil company because I'm such a huge fan of it. I just think it's brilliant. But like if you look at all the guidelines, that is the first line best treatment. You can have a coil at any age. With the free contraception scheme, it's covered. So you're getting both contraception and you're getting treatment for your heavy periods. So it's brilliant.
A win-win.
Win-win. The pill, that's the other thing. So it is a myth that you need to get a period each month. So women who take the pill, traditionally, we would always say to them, I'll take a 7-day break. We've now moved to a 4-day break, which is better for contraception. And lots of women just running their pill packs together. So no period. So you get the benefit of no pain, no heavy bleeding, good contraception. And there's no downside to that. It's safe to run the packs together. And sometimes if people run 3 packs or more together, they might get a bit of spotting, breakthrough bleeding, but it's still fine to do that.
And what about when women, because they do say this, they go, oh, that worries me now because how do I know if I'm not pregnant, or I'd like to have a period? Like they don't necessarily like a period, but they feel there's something natural period, even though a period on the pill isn't a natural period. But you can work with women about what they want as well, can't you?
Oh, absolutely. Like there are non-hormonal options, and I often have people say, look, hormones don't suit me, or I don't want hormones. So certainly constant, great painkiller, also reduces the heaviness of periods. There's another tablet called cyclopentone we use for heavy periods. And then for women who are older, whose families are complete, there are kind of minor surgical procedures that can be done. So example, an endometrialization to burn away the lining of the womb so it doesn't go back as much each month. They're really good options. So everything isn't hormonal. And sometimes if you do go with a hormonal option, one, let's say, pill might not suit you, and you might need to try another pill till you find the right one.
Okay. So lots of different options out there. And a good yardstick for what's abnormal is whether or not it's interfering with your life, and the first protocol is the doctor. Let's move on to tracking periods and apps. Here we are on Instagram Live. Who would have thought? Who would have thought a decade ago that this would be a thing? maybe lots of people, but certainly not me. But for people who do want to plot it for loads of different reasons, maybe knowing where it falls, maybe knowing about their fertility or those types of things, talk, I suppose, people listening about the usefulness of tracking your period and the apps that they can get involved.
So probably the two commonest apps that I would see people use would be Flow or Clue. So when you log on to those apps, it'll ask you, your age, it'll ask you, are you thinking about getting pregnant or not? Because often people are using them to track ovulation and to track their cycle for that reason. If, let's say, if you've got a coil, you might want to track your bleeding pattern after that's put in to see how it's working for you. So it gives you lots of really good detail about when you're bleeding, the amount of bleeding you're having, other symptoms like PMS symptoms. So that might be things like bloating, mood changes, irritability. You can track all of those. And if you do it for 3 months, it gives you a really good overall picture of, I guess, where you're at. And then if you go and see a doctor, you can pull out the phone, which lots of people do, and they can show you, look, this is where I'm at and this is where I'd like to be at.
I'm really glad, I want to talk about fertility and tracking in a second, but I'm really glad you mentioned PMS there again, because we talked about you can take tablets to reduce the flow, you can take hormones, you can take a coil, and these things will help with heavy periods and pain. What about for PMS? Because the people who really suffer with PMS, and sometimes it is just for 2 nights or a night before their period, a week before. I've had women go, it's only a couple of days a month, I don't seem to have it. So what can they do? Because that's actually really difficult, because it interferes with their relationships, their functioning at work, and how they kind of feel about themselves.
Yeah, like they'd say up to 40% of women will have some level of PMS, and maybe 5% have really severe symptoms. So I guess the common things that we would use would be vitamin B6 if you're thinking about going non-hormonal. There's certain contraceptive pills like Yasmin, for example, can be very helpful. Then SSRIs, so antidepressants, but they're not being used for depression, they're actually being used for PMS. So sometimes people don't like the idea of that, but you're not using it because you think they're depressed, you're using it to help with their PMS symptoms.
Not saying, oh, this is a mental health, you're saying, I see this, but this may help with your symptoms.
Exactly. And then there are some benefits then in lifestyle changes. So the usual healthy diet, exercise, good kind of sleep hygiene. CBT is also really helpful. Seeing a dietitian can be helpful for women who have really severe PMS as well.
Just if you've just joined us, I'm talking to Dr. Vicky O'Dwyer, who is consultant obstetrician in the Rotunda and the director of gynecology. We're talking about periods. We're talking about what's normal, what's abnormal. We're talking about what you can do if you are in the unlucky position of living with abnormal. And we're talking about tracking them on apps and what are good. And I will post this afterwards, so people will be able. Somehow I'll work out how to do that. I'll save it and post it so people can look at it in highlights. But Vicky, I remember when I was in my teens and I did have irregular periods, and they would kind of go, they might go 6 or 8 weeks between periods and all this. I remember going to a GP at the time, kind of, oh, this is a bit weird. And I remember her looking at me and kind of shaking her head sadly. I was about 15 and saying, you'll probably really struggle to have children. Now, when I look back at that now, by the way, 4 children and 3 of them were conceived, I was going to say on one night stands with my the point being is that I never had trouble, but women worry about this. They worry about fertility in terms of their cycle, and they don't necessarily need to. There's quite a lot of variation in there, but if you're looking for the fertile time in order to get pregnant or avoid pregnancy, can you talk to people about that?
Okay, so a little bit of maths here. So you're going to take your cycle length. So let's say your cycle is 28 days, and you're going to subtract 14 to get your day for ovulation. So if you have a 28-day cycle, you ovulate on day 14. If you have a 35-day cycle, take away 14, you're going to ovulate on day 21. Okay. So your fertile window is that day plus or minus 2 days. Because you know that the sperm can live for up to 72 hours, 3 days. So if you have sex before ovulation or after, you may.
What you're saying with my quick maths in my head is if you have a 35-day cycle, you have sex between day 19 and day 23. Yeah, and if you have a 28-day cycle, you have sex between day 12 and day 16. Yeah. Yeah, okay. Or you avoid sex to some extent in those things if you're not using good contraception from somewhere else.
Exactly, yeah. So lots of people will track their cycles for contraceptive purposes. The other things people would use would be checking their basal body temperature. which will rise at ovulation or just after ovulation, and home ovulation kits. You pee on them a bit like a pregnancy test, and they'll pick up the LH surge, which is the hormone release when you ovulate. So lots of people using those. And then there's a blood test that we can do, which is done 7 days after ovulation. It's progesterone level, and if that's above 30, we know you've ovulated in that cycle. But like generally, if your periods are regular and they're between 21 and 35 days, you probably are ovulating each month. If you've got a longer or shorter cycle, you may not be ovulating, but we can fix that with medication.
And people do some changes in discharge and stuff like that as well mid-cycle?
Yeah, so mid-cycle, people can notice an increase in their discharge, and that can be a sign of ovulation as well, yeah.
Okay. So is there anything else you think that people need to know in terms of the conversation around periods? Because it's quite groundbreaking to even be having public conversations, if you ask me, around periods when for so long they were utterly taboo and considered dirty almost, and certainly secret. And, you know, I think how I was told about periods was, I think my mother shoved a sanitary towel at me in that looked so, I was like, what the hell is that? When I was about 11 and said, keep this in case you need it. I didn't really know what she was talking about.
I know.
But is there anything else that you think people should know that maybe they don't know, Vicky, that I'm not thinking of asking you, or that we haven't come up with? And by the way, we're not going to be here for much longer, but if you have any questions, stick them in, because you have access to Vicky and she's amazing.
I guess the main thing is really to be proactive about women's health. So, you know, if you think it's not normal, as I said, if it's stopping you from what you'd like to do, to go and see someone. If you're on a fertility journey, if you're not getting pregnant, go and see your GP, you know, have the testing done. You may get pregnant while you're waiting on the results, but again, it's about being proactive. In terms of the kind of people not talking about periods, one of the greatest things actually recently was, you know, on the ads for pads, like always, that the blood is now red, it's not blue.
The blue thing appeared for years. It looks like the stuff you put down a toilet, like the domestic, doesn't it? Crazy stuff.
Again, for the kids, there's a really good book called What's Happening to Me. There's a pink version and a blue version, and it's good for kids that are kind of coming up to getting the first period, just that they have a bit more information, that it's not frightening, that it's normal, that we all get periods. And I think talking about it like this is really important.
Yeah. And maybe last thing, we hear a huge amount about infertility, and I think particularly because young women are on contraception to plan, you know, their pregnancy. But it seems to me, because maybe they've been sexually active for years without a pregnancy, that they kind of think, oh, this may be hard for me, and we hear a lot about that. I would have seen a huge amount of women coming in who are saying, I'm thinking of getting pregnant next year, so I'm going to come off the pill, and they'd be pregnant the following week, and they'd be shocked. Like that exists too, the falling pregnant way before you expected it, because you kind of have an idea in your head it's going to take you a year, and it doesn't take, and it takes some people that length of time, and that's fairly normal. But some people, it's totally different.
And one of the myths I hear a lot is that being on the pill for a long amount of time is bad. It doesn't matter. Like, it's not affecting the number of eggs that you have there. You'll still have them. Sometimes it can mask an underlying problem. So you come off and your periods are really irregular, and it turns out you have PCOS and we didn't know that. And PCOS is really common and maybe a little bit overdiagnosed. But certainly you can be on the pill for a long time, but you can come off it and get pregnant. And I think, you know, a lot of people think, well, I'll get pregnant in a year, I get the house first, or we might get married. Like this, you know, I'm waiting on that promotion. There's never a good time. Like, if that's a priority for you, you know, I think just go for it. Yeah.
There's never a perfect time, because having a child is a bomb in your life, let's be honest. I'm going to let you go in about 2 minutes, Vicky, but just some questions have come in, and this is a real question that speaks to parental worry, but also people not being sure what's normal or abnormal. Hi guys, my 12-year-old has a 20-day cycle. Do I need to get this checked out? She has had periods since she turned 11.
No, I mean, that's just outside the 21 days. So really, it's only if it's bothering her. I guess periods are one of the few things that get better with age. So you might find in a year or two, the cycle will lengthen a little bit. If the bleeding's not heavy and it's not bothering her, just keep an eye on it.
Yeah. Look, thank you so much for sharing all your expertise and all your insight with us. I hope all the people who have listened have gotten something out of it. I think these conversations are really important. It isn't just the content of them, it's the very act of having them. I mean, you know, at one stage, these conversations didn't exist, even among you know, people, the euphemisms, Aunt Flo is visiting, you know, this kind of, in women talking crazy stuff. But anyway, look, thank you so much to Dr. Vicky O'Dwyer, who is the Director of Gynecology in the Rotunda, and thank you to the RCSI and to the Rotunda and to Science Ireland as well, because that's what this is all about. This is Science Week. I'm Dr. Ciara Kelly. Thank you for joining us. I will try and save this. For all my knowledge of anything to do with medicine, my knowledge of Instagram is not quite as good. But thank you all, and I hope it was. And thank you, Vicky. Really appreciate it. Thank you. Have a lovely evening.
You too. Bye.